Hi, it's Marvin, and today we're talking about sepsis. I'm going to try and relate some of the things that you learn in medical school and a little bit at biology A level, and I'm going to try and relate that to this really dangerous and complicated disease, and just give you a bit of a flavor of the things you'll be learning and maybe um, treating as a doctor. I'm going to go through explaining what sepsis is, how it works, what that process is like. I'll talk very slightly about the organ systems and how sepsis can affect them. We'll talk about the treatment of sepsis as well, and then we'll finish with a case study. A term you might have heard before might be septicemia, which is what I came across before medical school. And that's what I thought sepsis meant. And it's just a terminology thing. But so in the past, people referred to septicemia because emia means presence in the blood, and septic means the presence of pathogens, of bacteria, viruses, etc., in the blood. Now we've moved away from that definition because as research has come out, of doctors and other researchers have published papers looking at the physiology of the basic science behind this disease process. We've moved to a different definition, a new model of sepsis. And the current understanding of sepsis is that it's an extreme immune response to an infection, which leads to organ dysfunction. So, in a sense, it's a really, really bad infection. It's like the endpoint of an infection, the worst that an infection could become, but not necessarily because of the bug itself, but because of the body's response to the bug is so extreme, as it may have to be, that actually our organs start to get out of whack and it all goes downhill essentially. And it's a really, really big, important, dangerous condition because over 23,000 people a year die from sepsis in the UK, and it's treatable in most cases, and it's really serious if it's untreated. Please excuse any background sound. It's my rabbits chewing away on some cardboard. But okay, let's talk about sepsis. Let's go from the beginning. So we have an infectious agent. In this case, we're going to take bacteria as an example, as a lot of cases of sepsis are. And this could be, an infected cut. It could be a urine infection, a pneumonia, really any kind of infection at all that just develops and becomes really, really serious. Um, and as this bacteria, in this case, is spreading and multiplying in the body, it is going to be recognized by immune cells. And also, your immune system will recognize the damage that's being done in the body, whether that's through toxins or other kind of mechanisms. So there's new immune response. Cytokines are produced, immune cells are activated and multiply. We get release of all kinds of chemicals, chemokines, etc., etc. And this causes an inflammatory response to try and get rid of this bug. And in the case of sepsis or any serious infection, this would lead to a fever, usually. So temperature goes up, sweating, blood vessels can get leaky because that helps the immune cells to get into the tissues where they need to essentially fight this bug. You have your hormonal glands, like your adrenal glands, other kinds of glands will be releasing hormones to get your body in a fighting state. And your mitochondria in sepsis, they seem to dysfunction, so they don't work as well as they should. And that process of oxidative phosphorylation, it starts kind of malfunctioning. And a lot of the reason why there's damage to the body and to different tissues seems to be because of the mitochondria, which are dysfunctioning in sepsis. And a combination of all of these and really complex interactions between all these processes mean that we start to get organ dysfunction or organ failure. And we'll talk about the organs in just a second. Okay, so here we've got some vital organs, and this slide is really an overview slide. It's not going to be detailed, but hopefully it'll give you a flavor of just what's going on with the organs and in sepsis. So at the top left, we've got the heart. The main function of the heart is it's a pump. It pumps blood around the body because we need to get oxygen to our tissues, we need to remove waste products, and we also need to get nutrients, things like glucose, all that stuff around the body. And in sepsis, basically the pump can start to fail. It doesn't work as well as it should, and that's a problem. Now, below the heart, we've got the lungs, which are responsible for gas exchange, which is bringing in oxygen from the air into our blood and getting rid of CO2 from our blood into the air. And in sepsis, all these inflammatory markers, the cytokines, the immunoglobulins, etc., etc., can cause a buildup of fluid in the lungs. And when there's fluid instead of air spaces in the lungs, gas exchange is impaired. It doesn't work as well. And so oxygenation in general is quite a big issue in sepsis. Below the lungs, we have an image of the stomach, which to me represents also the rest of the digestive tract. And in sepsis, because digestion isn't a priority for your body, blood is redirected away from your gut to other organs. And the knock-on effect of this is that you can't absorb very much by eating or drinking. So medications in sepsis aren't given as tablets or fluids, but they go straight into the vein. At the top right, we've got the brain. And besides higher functions like reasoning, thinking, doing your A levels, it controls your breathing, your temperature, your hormones, and there's effects on all of these from sepsis. Below the brain, we have the liver. The major function of the liver is just storing and releasing energy, but it also produces proteins. These proteins are really important in clotting, so stopping your blood from bleeding, essentially, if you have a cut, and that can go haywire as well in sepsis. And lastly, we've got the kidneys, and what the kidneys do is that they filter the blood. They're like a big, Brita filter or something, and they remove waste, and they also balance out all the fluids and the electrolytes. And the kidneys need a lot of blood going to them to keep working. So if the heart stops working as well, then the kidneys can be the first organ to start packing in. And really, this is just to demonstrate that all these organ systems are linked to each other because they are responsible for some function in keeping you alive. So if one goes wrong, it's likely that other organs are going to be affected. Okay, here's our case study. We have David, 17-year-old, who is in hospital for an appendectomy, which is a surgical procedure that you do under general anesthetic, where the appendix is removed, which can sometimes become inflamed. So a couple of days after his operation, which runs really smoothly, he sat in a bed and he's seen looking really sweaty, he's shivering, he looks confused, he looks awful, he looked really, really unwell. And so the nurses notice that and they come over, they take some basic observations. So they take his temperature, which is high. They have a look at his wound site, which is red. It looks hot and swollen, very angry wound site, very inflamed. And the nurse is worried as his blood pressure is really dangerously low. Nurse calls you because you're the doctor today on the ward and says, "Doctor, I'm worried about this patient. They look really unwell. What are you going to do?" Let's talk about that in the next slide. So these are some of the things that you would do if you're worried about sepsis in a patient. And if we start on the left, we have this mask that this man is wearing. That's an oxygen mask. And through that mask, you give very, very high amounts of oxygen. And the reason for that is, as we've mentioned, if the heart is not working so well, if the lungs aren't working that well, if all the capillaries are a bit leaky, then we're worried about this person's tissues not getting enough oxygen. So we give oxygen to try and increase our tissue oxygenation. And then at the top, there's that's a fluid, that's IV fluids, which means intravenous. And as we've mentioned, the gut isn't absorbing very much at the moment. So we're going to give fluids straight into the bloodstream, bypassing any need to absorb it or anything like that. And on the top right, this kind of jelly-looking thing, that's a blood culture. That's a really important thing to take. So you take a small amount of blood from the patient and you try and grow, using cultures, you try and grow some bacteria. And this will help tell you what bacteria, what bugs are going around. And then you can tailor the antibiotics you use to fight specifically against that bug. And obviously doing all of this stuff is useful, but it doesn't solve the underlying problem, which is that there's an infection. And as bacteria are the most common cause of sepsis, they would be getting antibiotics, intravenous antibiotics. Okay, just a wrapping up of what we've spoken about. Sepsis is a life-threatening condition. It needs to be treated as soon as possible, but it's not always easy to recognize. But a big part of any doctor's practice is going to be knowing what this looks like and knowing how to treat it. And at medical school, one of the most important things to do is just to understand the basic physiology, the basic way the body works. Because once we understand, for example, what the organs do, their functions, and how they affect each other, once we understand that, then we can begin to understand how disease processes affect the organs, and then what we're able to do as healthcare professionals to intervene and change some of the physiology, change some of the dynamics to hopefully make people a bit better. So sepsis is not easy to understand, but I hope that was a bit of an introduction and that it was useful for you.